Welcome to the Motion Lab, the podcast that explores the science of movement and helps you live a stronger and healthier life.
Welcome back to the Motion Lab podcast. My name's Chuck Dowell. I'm one of the physician assistants here at Colorado Springs Orthopaedic Group. I'm here with Dr. Van Manen.
Nice to be here.
And Dr. Yeager.
Thanks for having me.
All right. So season 2, the first episode, we're in Colorado. It's a big ski town slash state. We thought we would go over specific things we often see in clinic regarding ski injuries. We have one snowboarder, former skier, and one skier currently.
Former snowboarder.
Former snowboarder. Wow, you guys are going opposite directions. So let's just start off at the beginning. Like, what are the most common injuries that you see in clinic regarding, let's start with ski injuries.
So, I can take this one. Ski injuries, it's a lot more common to have lower body injuries because your feet are not connected by a single board. The fact that they can move independently, oftentimes that will create rotational injuries. Also, having a giant lever arm attached very rigidly to your foot kind of causes torsional injuries. So ligamentous injuries of the knee, meniscus injuries, tibia fractures can also occur with ski injuries. So those are far more common with the skiing population. What we see more commonly in the snowboarders are upper body injuries, wrist fractures, clavicle fractures, shoulder instability, humerus fractures. Because they are linked, they can't really compensate with their lower body. So when they fall, they tend to fall and use their upper extremities to brace themselves. So it's just far more common to see kind of that dichotomy of if it's a lower body injury, I can almost guess that they're a skier. 9 times out of 10, that's correct. And same with upper body injuries.
Do you think there's a difference regarding experience level? I know some of the literature shows that beginner snowboarders tend to injure themselves more, and then more advanced skiers tend to injure themselves more. Have you seen that as far as experience levels?
Yeah, and it also depends on the experience levels and what kind of terrain they're going down as well, too. So, if you're trying to be, an Olympian at an older age, you're probably going to be a little bit more prone to having an injury. But your body adapts to the proprioception and the experience, those neural pathways for being able to participate in the sport, such as skiing or snowboarding, are going to be a lot more easier to compensate if there's an injury. But again, it just depends on how risky you are as a skier or a snowboarder. And as you get older, our joints get less mobile and our muscles start to get a little sarcopenia. So, if you're trying to do what you did when you're 18 years old and you're 75 years old, you got to be careful. So that just kind of depends on experience, and then also adjusting to your level and your conditioning at that point. Yeah.
So you were mentioning, Dr. Yeager, that you kind of don't advance past the blues. Do you think the terrain has a difference, like the altitude, the iciness outside?
Yeah, I think that matters. Number one, I do. I think that's really important. But I also think it kind of goes back to the old adage about how you learn these things. Snowboarding is considered hard to learn, easy to master. Skiing is easy to learn, hard to master. So I think when you're learning as a beginning snowboarder, you fall a lot. And you can pick a beginning snowboarder off the lift when you're riding it up. They fall their way down the mountain. Beginning skiers tend to not do that as much. I think where skiing becomes harder, which is, to Mike's point, is as you start to increase your confidence, you start to progress to more advanced terrain. Things do get harder. They get more technical, and that form becomes a lot more important. So I think a lot of it just depends on the different sort of the mechanics it takes to learn each discipline and then truly master it. So snowboarders, probably early on, they just fall a lot more. As they get more comfortable, then they tend to do fine as they progress through the advanced terrain. It's kind of the opposite for skiers.
Yeah, because a lot of the snowboarding falls are uncontrollable because they're kind of falling backwards, and like you said, they don't have that ability to kind of adjust. Versus the skiers, they can kind of pie their way down the mountain, and they can go very slow and very cautiously, which doesn't lead to as many injuries. But then when they go on these uneven terrains or these unpredictable terrains, that's when those rotational twisting injuries can happen.
Every snowboarder will tell you too. They'll tell you one time that they just caught an edge. There was nothing there, nothing really happened, but suddenly they're on their back or on their hands. It just happens, and it happens fast. when you catch an edge on a ski, you've got another ski.
Yeah.
So sometimes that can happen, and you can kind of balance yourself, save yourself a little bit. So there's a little bit of margin for error with that. That's just not there when both feet are linked to the same board.
Yeah. Plus with skiing, the boots can unlock.
Yeah.
So if you're in a certain position, the boot will unlock, you'll lose your ski.
Yeah.
That doesn't happen in snowboarding.
Yeah, that was my next question.
You're not only linked with your lower extremity, but the boots don't unlock in a snowboard. So if you catch an edge, which the terrain does matter, if you're on hard pack or ice, snowboarding can be a lot more difficult to stop or catch the edge on the ice. And then you're falling either forward or backward depending on where you're at position wise. So wrist fractures, clavicles. Those are because you're falling on your shoulder or you're falling back. So, shoulder dislocations, which I have an experience with, are more prone, when your boots don't unlock. Yeah. You're falling, that trauma and that energy is being transferred, with your arms. And that could be full body, 2 to 3 times body weight coming right on down your arm.
And they don't realize how many times they've fallen until the next day when they're sore from everything.
Their butts killing them. The tailbone injury. When I was learning to snowboard after being a skier, that was probably the worst. Was 24 hours. You're walking and your tailbone's just completely bruised.
You're just walking around with a pillow.
Yeah, exactly.
Pillow all day.
Yeah. Hopefully it's not broken.
Shame. So I guess you guys both mentioned it regarding like bindings or your ability for that to pop off. Do you think there is a component of that, like how easily? I mean, one of the questions I always ask when somebody comes in is, did your binding pop off? Because it kind of tells me how much force of rotation they had and whether that can maybe create a ligamentous injury. Do you think that equipment fit or the binding settings?
Well, the settings can be adjusted, based on your weight, based on the length of your ski. Yeah. And so, and then everybody, depending on how tight they want them, again, coming back to the experience level, can get that adjusted. But usually you would hope if it unlocks before you tear your ACL, but unfortunately, that doesn't happen all the time.
Personally, I keep mine pretty loose. Yeah. I'd rather my ski pop off, but I'm not a fast skier. That's my goal. I'm not the guy going 50 miles an hour down the hill. Those people need to have their skis more firmly attached to their boot, because your ski coming off while you're skiing is also a risk factor for injury. So, and I think this is where, around here, it's very common and it's easy for us to find a good boot fitter, a good ski shop that can really listen to you and say, what's your skill level? What do you do? This is how we should do your setup, versus just saying, I like them to be as tight as I can. That's probably not the best choice. Yeah. So really making sure that it's set up for you and that it's custom for you and what you want to do and how you ski or how you board. That's really important.
And you had mentioned earlier regarding falling. I know I've read a couple studies that show like if you're catching an edge, especially with skiing, you kind of lean into the fall. Have you noticed anything about that? Like the uphill leg versus the downhill leg tends to get injured more? Or is there a specific recommendation? I mean, it's hard to control a fall, but can you control a fall?
I think you can to some degree. I think by the time people get to us, their injury is so severe that they're not really able to tell me consistently how it happened. Yeah. I had one today who trying to get out of the way of a small child, and she couldn't really tell you which ski it was or how it went down. Yeah. Just she felt a pop in her knee and it hurt. There was I was sitting at the little cafeteria area of the mountain yesterday, and there was a person there with a brace on. I struck up a conversation, and she said she was doing bumps and knee just caved in. So it's different, and I don't think it's always the same. But there is usually something unexpected. Either it's ice, either it's another person, either it's the terrain that you're not used to. And then sort of an inability to navigate that is usually what it comes down to.
Is it an orthopedics need for curiosity that anytime we see somebody with a limp or a brace, we have to ask them?
I usually try not to. We just happen to be sitting there.
It's just subconscious, just like kind of like you zone in on somebody that's limping or has a knee brace on.
If I see a limp or a brace, I'm like, I wonder what's going on there. Like,
just kind of, we do this job all the time for so many years.
If they're in a ski lodge, I can make a pretty good guess as to what it is.
Sometimes even by the brace, you'd be like, I know what that brace is for. Like, I know why you're wearing that. So let's say somebody falls and injures themselves skiing. When would you recommend, if they're watching this video, when would you recommend they come and get evaluated? Like, what are the key things you say, hey, this probably should be checked out, or hey, maybe you can give this 48 to 72 hours, ice and elevate and see how things go?
I mean, it just kind of depends on the initial assessment from ski patrol. You know, if they got evaluated at the urgent care, got x-rays, you know, a lot of times they get that workup before they come see us.
Yeah.
You know, nice. Or they go to urgent care, you know, that's open after hours, after the injury. You know, a big thing, it just kind of depends on, you know, what extremity you're looking at. For a knee, for example, I mean, if they have an effusion and they didn't have prior knee pain or they didn't have any prior injuries or prior surgeries, an effusion after a ski injury in the knee is you know, you're going to be worried about something. Yeah. You know, and then it just comes down to the exam. And of course, what the first workup is as far as being able to tailor what the next, you know, diagnostic study is or what the recommendation is for recovery. You know, and again, if you can get the information on the mechanism of injury, I think that does help. Yeah. You know, a witness or if they're with their kids and, you know, they kind of describe what happened, you know, that kind of helps. But again, like Dr. Yeager was saying, a lot of times they don't know. It just happens so quick. Yeah. Here they are having fun going down the hill, and then, boom, they're on their back. Yeah. The skis flying down the hill. You know, sailing everywhere. Yeah, exactly. Yeah. But yeah, I mean, a lot of it, you know, if they have an upper extremity injury, you look for deformity. You know, a lot of times they'll be able to diagnose that if, you know, the ski patrol needs to come or whether they are able to get down the slope on their own. Yeah. You know, when I dislocated my shoulder, I was, you know, I knew it was out. I just was able to kind of snowboard my way down and then get evaluated.
Yeah.
And Dr. Van Man is unique in that regard. Most of the time, what I tell people is if you can't make it down, you need to be evaluated.
Absolutely.
So if you have to call ski patrol, if they have to toboggan you down the hill, then you need to go get it looked at.
And I think most people do.
Yes.
For the most part.
I would agree.
If something's hurting, they're like, I can't get down the mountain. Yeah. You know, or they have family with them, and the family's like, okay, mom, dad, you know, we can't get you down. There's no way of getting down this if they're on a blue or a green. The terrain's just too daunting for them. So most of the time, you know, ski patrol shows up.
And kind of conversely, I think most of the time, if you can make it down, then it's generally speaking, unless your shoulder's dislocated, okay to give it a day or two and see how you feel. But if you're uncomfortable, it's always best to have somebody look at it. Yeah. If you're unsure, it's always best to come in, see somebody as quickly as you can, be at an urgent care, make an appointment. If for nothing else, your own peace of mind, your family's peace of mind, just to make sure that everything's okay.
Yeah, I kind of knew exactly what happened, you know, so I was able to kind of, you know, because when you have a dislocation, the quicker you put it in, the better. Yeah. Before you know, it's a muscle spasm that keeps it out. So, you know, I kind of just knew I was kept relaxed, and as I was kind of snowboarding down, I just kind of pulled it. And just
0% chance I'd be able to do that. None. Calls.
I think I just got lucky.
we all know ourselves.
But you know, getting back to my example, you know, when it comes to terrain and when it comes to injuries, it's kind of finding that balance where you're enjoying yourself but not pushing past your limits. Yeah. And I think a lot of times we see injuries where people are, you know, they're having and it's especially at the end of the day. Yeah. You're fatigued. You've had a lot of runs. You're kind of getting to that end of the day, and you want to get that nice big run at the end of the day. Yeah. And you're already tired. You don't really realize you're tired because you're having fun, and you try something maybe you shouldn't try. And this was my example. Yeah. And I decided to go to the park at the end of the day and try to do a box jump, you know, and it was like probably not the right time to do that. And that was my personal experience. But a lot of times when I evaluate patients, they just push that last run, and they went into the trees, and they went out of bounds, and they just got a little bit, you know, ahead of themselves, and they kind of pushed the limits, you know.
And there's definitely some component of that, right? Fatigue creates our body's inability to protect itself, our body's inability to kind of have that proprioception or that self-defense protective mechanism, and that's when we see a lot of injuries, even outside of skiing, right? Even with sports related injuries, you know.
Take that sports analogy. I think this was something I was thinking about as I was thinking about this podcast. You know, if we're going to play a sports game, what do you do before the game? You warm up, then you play the game. Then what do you do after the game? You cool down. It seems to be skiing. It's the opposite. You start out kind of light. You build, and then your last run of the day is the hardest thing you've attempted the entire day. Right. Terrible idea. Yeah. Your muscles are your dynamic stabilizers, you know. So, and if your muscles are fatigued, you are going to lose some degree of stability. They are unable to maintain the joint's position, its location in space. It puts a lot more stress on your static stabilizers, like your ligaments. You're far more likely to have a ligamentous injury at the end of the day when you're tired, doing that black run that you've been building up to all day. Yeah. It's the worst time to do
Yeah.
it. You should finish out on some easy stuff. Cool yourself down. It's a much smarter way to manage the slopes.
Those should be all the midday runs. The advanced.
If you're going to do it at all, maybe not me anymore, but if you want to do that, do a couple warm-ups, do your hard stuff, then ease into more easy stuff.
Some nice stuff just to finish the day off. Yeah, makes sense. So let's say we have a patient from a joint replacement standpoint, and our skiers in town. Always the first question is, when can I go back to skiing? What's your kind of general recommendation for that?
Well, again, it's very patient specific, and you have to, how experienced are they before they ended up getting their knee replaced, and then look at deconditioning. We talked about earlier before the podcast. Some people can live pretty good with their arthritis leading up to the replacement, so they don't have a lot of atrophy or sarcopenia, and they still have pretty good proprioception. They're just in pain all the time. And so if they get their knee replacement, they go into the knee replacement with a certain condition. That's the condition, they can expect to start with. And if that's at a low threshold, it's going to take a while to build up the dynamic stabilizers, which is extremely important when you have a knee replacement, especially with the dynamic stability. And we talked earlier about the quad strength.
Yep.
So again, it just depends on their experience level, where they're at as far as their conditioning before they get their knee replacement, and then how they recover. How their knee replacement starts with mobility right out the gates. Some of the newer studies, when they talk about post-knee replacement in sports and return to play after replacement surgery, it's all about getting that muscle as conditioned as possible. And that can take up to a year. And that's based on some EMG nerve conduction studies, looking at muscle development, hypertrophy, as well as conditioning, controlling that knee replacement. Usually standard is about a year. So if you're going to pound on this knee replacement and put yourself in a position where you could still have some issues with mobility and strength, you're compromising, especially if you're a snowboarder, you're injury prone now, right? And then you can develop another injury because you're just not yet conditioned on that knee replacement. So again, it's very specific, depending on how they're recovering and how they get their quad muscle back, because that's very important as extensor mechanism, controlling the knee replacement. And preventing any type of ligament injury that can still occur after a knee replacement. You still have your collaterals, and of course, proprioception is a lot different with implants, as far as being able to feel how that knee is before you got it replaced, depending on your skill level, and then what it is after your skill level. After your replacement. So a good rule of thumb is probably a year, just because that's that's research and evidence based, that your muscle tone you're still gaining strength. You're still getting that dynamic support of that knee replacement up to a year, sometimes even more, depending on your pre-level of condition.
What about rotator cuff, sports, ACLs? What would the recommendation there be?
ACLs is a hard 9 months for me before any return to sport. If people push me and say they're not quite ready yet, it's not unusual for it to be a year before they feel comfortable doing it. I like to use a brace post ACL and MCL injuries too, for that matter, just for skiing purposes. I tell everybody to use a brace for their first year back to sport. Some people opt not to do that, but I think it's more of I use it more. The brace may not stop you from re-tearing your ACL, but it does help with the mental aspect of returning to sport post reconstruction. It just takes a lot to make that jump, that leap back into competitive sports. Skiing being such a high-risk sport anyway, a lot of times I tell people if it were me with an ACL tear, I'd probably just use a brace forever. It's not, most modern braces are fairly semi-custom with their fit, or custom, so they can go under your clothes, they can go under your gear, and they're pretty comfortable to wear. So for me, that's what I would do. And if people say, I think I want to do that too, I say, fine, go for it.
What about upper extremity? So if it's a rotator cuff, do you have any limitations?
It's not as something that we talk about as much for whatever reason. But I would say I would want their cuff to be well healed. And I usually like them to wait somewhere between 4 to 6 months before I kind of turn them loose to do whatever they want. Most of them, I would say, for skiing, especially if you're doing lots of poling, if you're doing more technical skiing that requires a lot of more pole use, waiting until 6 months at a minimum, I think is a good idea. And if you wanted to wait even longer than that, we know rotator cuff recovery will continue for a year to sometimes even a year and a half out from surgery. So it's really all about your comfort level, how you like to ski, what you like to do. I'd say that's kind of where I'm at.
Would there be a different recommendation if they said I was a snowboarder versus a skier, knowing that the injuries in skiing are mostly lower extremity and the injuries of snowboarding are mostly upper extremity?
Maybe a little bit. I think the issue that they would run into is not necessarily the falling per se. It's more of just the repetitive up and down. Yeah. It's the getting off the lift and any sort of pushing that you have to do, the sitting down to do your bindings and standing back up. There's a lot of pushing off the snow, even just normal outside of an injury that snowboarders may experience as opposed to skiers.
From an injury prevention standpoint, I mean, as you mentioned, Dr. Yeager, you know, the appropriate way to do it is to warm up and then to participate in your activity and cool down. But you don't see anybody stretching on the ski slope. Like, when was the last time you saw that? Yeah. So from an injury prevention standpoint, what's your generalized recommendation? Somebody comes into you a year out from a knee replacement or a soft tissue surgery, and they say, I want to ski this season, but what would you recommend as far as getting myself strong? Are there general principles or exercises you'd recommend?
Yeah, I mean, the routine, you got your routine post-op knee replacement that first 6 weeks. That's kind of phase one. That's, soft tissue healing, incision healing, getting your motion. And that's where the scar's kind of remodeling and maturing. And then you get into phase 2 and phase 3, which is kind of a gray area exactly where that cutoff is. But that's getting back to your dynamic support and your muscles and getting your ligaments back into condition again, your static ligaments, scar tissue is more mature. That's when your muscles are going to be able to start really kind of getting more conditioned. Mm-hmm. So after the routine total knee protocol, even with the total hip, which is a little bit different. Total hips are a little bit different as far as, knee replacements, but standard, your standard proprioception, your standard making sure your core is strong, making sure your abductor muscles are strong to support the knee, quad muscles, range of motion. I mean, you have to really get that conditioned, and that can be anywhere from, different protocols. I mean, there's not a hard, fast rehab protocol, very similar to an ACL. It's any knee surgery. You got to get your posterior chain and your anterior chain balanced correctly. Quads are just such a huge facet of knees, for post-op knee. Your quad is just one of those muscles because it's an endurance muscle, but it's also a power muscle. And so you have to train it in various different degrees to get that full hypertrophy back and that full control of your quad, with the dynamic support of the knee. Whether that's, doing different exercises, mobility exercises, stretching exercises, strength exercises, based on different routines, whatever works for you. But yeah, you should, like I said, after a year to a year and a half, you can still gain quad strength, especially in people that are so deconditioned. That surgery is a second hit to that quad. And so it takes a long time. And I think Dr. Yeager could confer, that's the big thing with ACL reconstruction is quad support. Exactly. So the same thing with a knee replacement. And we're not really, again, we're not worrying about the knee replacement mechanically failing. The components. Right. And it depends on if you get a press fit or you get a cemented knee. There's different mechanics there, but a lot of it is just your knee is just not, it's a reconstructed knee. Your proprioception is going to be off, right? And if you're going to be more prone to injuring your hip. The other thing I tell patients is periprosthetic fracture. And you have to understand when you're going to do something that's high impact with a possible high impact injury, the interface between the bone and that implant is a stress riser. And so that's an easier way for it to crack. And periprosthetic fractures, again, are tough injuries to take care of. And so people have to kind of be, again, understanding that, my knee can perform this, but should I be doing this? Should I be doing the moguls? Should I be doing this double diamond black? You probably have to you have to just understand and adapt that, hey, I just got my knee replaced. I don't want to have another surgery or have another injury because I wasn't in full condition before I got back to slopes.
And so when we talk about proprioception, that's kind of our body's ability to know where we're at in space. Mm-hmm. When we talk about dynamic stability, it's our ability for our mind to send a signal to our muscle, for our muscle to contract and protect ourselves, to get us out of positions that could be bad positions. And so after surgery or after injuries, we lose that connection or that connection's delayed. When you're going to twist your ankle, if your mind can send a signal quick enough, it can correct that and flex, those muscles to protect you from doing that. And so that's kind of what we're talking about. One thing I think a lot of people don't understand is that skiing, as you said, is a very independent, mechanism. And so we got to do a lot of single leg training. I mean, that's a lot of the times what I recommend is that you do not just bilateral squats, but you do a lot of single leg squats and a single leg kind of dynamic movements to build that kind of mind muscle connection, that proprioception up. What else would you recommend? I
think that's great. I mean, I also think general strengthening is important too. So, I mean, even some more traditional closed chain squats, deadlifts, lunges. Leg press is nice because you can do single leg and 2-leg press too. And spending, especially if you haven't skied for a season or two, if it's still something that you're relatively new to picking up, or if you just haven't been overly active before ski season, spending 4 to 6 weeks to do some light strength training before you hit the first run is really helpful. Anything you can get that way, number one, you're not so sore after your first day out there. And number two, you feel a lot more confident. You feel a lot more capable. You feel like you trust yourself and you know where your body is in space better. So all of those things are important. To train proprioception specifically, plyometrics is really helpful. Doing a lot of small jump training so you can kind of know where your body is in space. There is some data that proprioception training can help with ligamentous injuries, especially with female athletes. It's hard to find dedicated programs that do it. So I think any sort of dedicated strengthening and muscular training that you can do before you go out there will help and will absolutely pay dividends. It should also be a situation where your first run should not be a very difficult run. You should slowly over the season build into what you want to do and what you're trying to get back to doing. So don't just jump out there and go full tilt straight down the hill. You're going to run into trouble.
Yeah.
But I would say the biggest thing is prepare, just like anything else. The more you prepare, the better it works.
And when we talk about closed chain activities, you mean your foot planted against something, pushing against something, just in case anybody's not.
And that platform's stable.
Yeah.
That platform you're pushing against that's giving you the counter force is stable.
Yeah. And that's kind of more functional strength than the
strength training, hypertrophy. The term perturbation is a term used for some of the therapists to kind of test your strength and your maneuverability, with somebody kind of with an unforeseen force against you. And that's that, fall precaution. That's something we train to for, just post ACL, post any surgery, is being able to, especially in athletes, you're trying to see how they react with an unforeseen force, and you're skiing down the hill and all of a sudden that little kid jumps in front of you, being able to maneuver immediately is kind of training for that quick reaction. So some of those exercises are specific, that a therapist or anybody that's knowledgeable in it can help you with. And I think that's key when you're doing something like skiing or snowboarding, is because a lot of the terrain, a lot of times you don't know right away, especially if it's a whiteout and it's a blizzard, you're going down moguls, you may perceive one of those, a flat surface is actually a bump.
Yeah.
And all of a sudden you're hitting that bump at full speed and you have to react to that a certain way. And so that can be something to train for. That would help you after surgery get into a little bit better injury prevention on the slopes. Yeah.
So when we talk about either post injury and or post surgery return to skiing, or I haven't skied for a while and I'm going into skiing or snowboarding, it's about controlling the variables. There's things you can control. There's things you can't control. You can control your generalized fitness. You can control your strength and mobility. You can control your proprioception. These are all things that are trainable. You can't control the conditions. You can't control, the weather and or the iciness of the slopes. So the important thing is to be able to know the variables you can control, strengthen those or build those variables, and then reduce the variables you can't control. Don't go out on a bad day. What about back-to-back days? Fatigue is a big factor. I skied a lot one day. I'm going to be fatigued the next day. I'm probably at an increased risk for injuring myself that next day, right?
Yeah, and I think it's just being smart and knowing what your capabilities are. There's certainly people out there that ski over 100 days a season, and they do fine with that. But I think you need to be realistic how your body feels. Are you sore? Do you feel like it's not a great idea? Listen, your body will tell you what it's capable of. If you're willing to listen to it, then most of the time it'll help you make a good decision.
And it doesn't mean you can't go ski that day. It just means maybe don't push those more extensive runs that day. Stick to the lighter runs that day. Give your body a rest. Maybe do a half day, and then be able to participate in those, more difficult runs the following day after you've recovered and you're at a less risk for injury.
Yep.
So are there anything from a closing kind of remark standpoint? Are there anything that you consistently see in clinic that you kind of try to educate the patients regarding skiing, snowboarding, or just winter injuries themselves? Anything specific that comes to mind?
Well, I think we covered a lot of it, just kind of the overview here. Again, it's just kind of putting all the variables together. the controllable variables and the uncontrollable variables. And then the big thing is being able to know your limits. I mean, especially as you get older.
Yeah.
And a lot of times, especially middle age, you hit middle age, you feel good, you're a little stiff, but you're still not like you were when you're 18 or 19, right? And especially if you have, your son or your daughter, and they're at they're at a mid-20s or a teenage, and they want to do some of the harder stuff. And of course they want dad or mom to come with them. And you just have to be real careful on being smart on what you're choosing to do, because if you put yourself kind of at that limit, and your limit, as far as your skill level, that's when you're prone to hit a tree. That's when you're prone to kind of have a serious injury, and these are all injuries. I mean, we do see death on the slopes, and especially if you're coming out of state, you're flying in, it's a vacation, a Christmas vacation or a spring break vacation, and you haven't done a lot, and you're hitting some of the mountains here in Colorado. You really have to be careful. You really have to really kind of dial in the terrain, take it easy the first day if you're going to do it 3 or 4 days, and just be aware of your own conditioning. But as a general rule, it's just like any athletic event or sporting or weekend warrior, just kind of the limitation's the big one, and then stretch before, warm up, and guide yourself, gradually get into that level where you want to get to a certain level. If you want to do a certain run and you're gunning for a certain run, just work up to that slowly. And then don't over fatigue yourself. I mean, I think even in sports, overtraining, especially travel sports, I mean, you're constantly in competitive mode and you're constantly pushing and pushing. Just be aware of that, especially if you're going on a 7-day trip and you're going to be doing a lot during that time,
The tickets are so expensive. The instinct now is to be at that 8:30 first chair and go all the way till 4 p.m. and do it 5 days in a row. Yeah. And that's a setup for trouble. So, that's where I think be realistic about what you can really accomplish during your time if you're traveling. And just be smart. Make good decisions. If there's one preventative thing that we haven't talked about yet that really bears repeating, it's wear a helmet. Yeah. A lot of these people out there, some people still prefer not to do it. Fortunately, the vast majority of people do. But like Dr. Van Manen said, it's every year somebody dies on a slope, and it's oftentimes a head injury. So just wear a helmet. That's probably the most important preventative thing that you can do. Can be life-saving.
Thank you for joining us for this episode. I hope you enjoyed this talk regarding ski-related and or snowboard-related injuries. If you do ever get injured on the slopes, you can call us at
719-632-7669.
Or I work in the Express Care downstairs. It's a walk-in orthopedic kind of urgent care clinic. We're open 9 to 5 during weekdays and 8 to noon on Saturday. You can walk in at any time. We can evaluate the injury, and then we can order appropriate testing and refer it to Dr. Van Manen or Dr. Yeager to kind of go over that testing and discuss what to do from a treatment perspective. Thank you guys for joining us. I appreciate it.
Yeah, thanks for having me.
Appreciate it.